right, guys, welcome back. On this week's episode of Bone Apple Tea, we have an interview, which we haven't done in a while, so it was kind of nice to sit down and talk. We talked to Dr. Amber. She's a naturopathic doctor, specializes in women's hormones and peptide therapy, more specifically. So, what is peptide therapy? Well, you'll find out in this episode. We go into what it is and what it isn't, because there's some misconceptions there. It's kind of becoming more popular, used a lot by athletes. And we go into various peptides and their uses, some very interesting ones that have some weird effects that you'd be like, I didn't know you could
do that.
just randomly. Yeah. So one of them, I mean, as an example, like one of them like will make you tan. And so we kind of talk about that and how it works and that kind of thing. Because it sounds really weird when you hear it at first. I'm sure you're wondering now, like, what?
How can that happen?
Yeah,
Find out in this
Yeah.
episode.
Peptides, that's how. So, but yeah, we discuss all of that and, kind of maybe the future of peptides or if it will become mainstream and then some quick bits about some laws that were recently passed about peptides. But yeah, that's the entire episode and enjoy.
I started talking to you just because of Omar.
Yeah, that's right.
Yeah, I was on Omar's Live that one day.
Yeah. And it was funny because I remember seeing you and he told me, he's like, hey, you got to come check out Dr. Amber. And so, I hop on and obviously I had a ton of questions. I think I was like the only person asking questions because it was just like, it was like rapid fire. I was like, wait a minute. So you're telling me there's what are peptides? What do they do? All this crazy stuff. So yeah, it's really awesome to be able to like talk to you more formally on our show.
Absolutely. Yeah. That was kind of your little intro when we talked about them on a live. And there's a whole world of peptide therapy to learn about. So we'll talk about a lot of different options and things that I use in my practice.
Yeah, absolutely. Which actually, speaking of your practice, like when you got your doctorate, did you originally think like peptides was the goal, or did peptides kind of come out of it at the later time?
Yeah, so I actually found peptides from my own health journey. I was a doctor already, and I pursued holistic medicine or naturopathic medicine. It's a 4-year degree similar to an MD. We have 2 rounds of boards, 1,000 plus patient contacts. So it's like very intensive training.
Mm-hmm.
And I originally was going to be an MD, but wanted, like, the word that kept sticking out to me in my job shadowing and really figuring out what I wanted to do with the rest of my life and in pursuit of medicine was like, I wanted to help people regenerate.
Mm-hmm.
And when I looked at the conventional model, I didn't see that happening in all of my experiences. And I thought, man, I don't know if I can really see myself going into an office and seeing these 15-minute patient visits all day long on an insurance-based system and people, walking in on 6 medications and walking out on a 7th.
Yeah,
and
right.
Because a lot of it
getting better.
A lot of it is like sick care. It's not really preventative care, and it's like symptom treatment, and it's not necessarily, something to make the pain go away for now until it gets better, maybe.
Yeah, like I remember when I did injure my bicep. This is back in like January, and I went to a doctor about it after it wasn't getting better for like a month and change. And the first thing he said was like, "Oh, do you want a cortisone shot?" And I was like, I don't know if it's that bad, dude.
They're right there. Yeah, I feel like they're very quick to be like, oh yeah, we'll just throw some cortisone in there. You'll be fine.
Yeah.
Which ultimately, takes away the pain, but destroys the connective tissue even more.
Really? I actually didn't know about that.
There's literature on that. Yeah, I used to do a lot of intra-articular joint injections and learned about, what cortisone is like. Similar to cortisol, it's anti-inflammatory in small amounts, but when you, over a long period of time, especially when our body chronically produces it, it actually breaks down connective tissue.
Wow, I didn't even know that.
Yeah.
Wow, so he was prescribing me something that was going to negatively affect me? Dang. That's crazy. So and then you get into peptides pretty soon after this initial, like, I think this isn't really for me.
Yeah. So I found naturopathic medicine. I did the training. It was about 11 years of school total. And then I really found peptide therapy after I had become a doctor already. I read about it in a book written by Jay Campbell. Are you familiar with him at all?
No, I'm not. Yeah, you know.
He wrote this book called The Testosterone Bible.
Oh, okay.
Great book, thick book.
Okay.
And he was really my intro to peptide therapy. He had been using them he's got a handful of doctors that he refers to. But I heard about peptides in that book. I started using them on myself. And I actually was pretty sick coming out of med school. I had a gut infection. I had adrenal fatigue just from all the chronic stress. And I had used some of the peptide therapies to really heal myself. I had a ton of food sensitivities. I was allergic to like garbanzo beans and hummus.
Oh, man.
Wow.
That was healthy food.
I love hummus.
And,
That would have been a bummer. No hummus. It's like a great appetizer.
And I managed to reverse all of those food sensitivities, the underlying immune dysregulation using peptide therapies, and a couple in specific ones called thymosin alpha, and one is called LL37. That's a gut peptide, an immune peptide. And so after that, I was like, wow, these are powerful. I need to learn more about this and how I can use these with patients, because this changed my life.
Right.
Yeah. And so I got trained in peptide therapy. A4M is an organization that trains doctors. And it was a pretty penny to get trained in peptide therapy, but it's like a 4-day, 12-hour training in all of the mechanisms of action and the dosing protocols and the indications, contraindications, all of the benefits and the uses and how to understand what peptides do in the body. And that was mind blowing in terms of the power of these therapies that a lot of people just don't know about yet.
Right. I mean, I had no idea about it. And I mean, we're both biomedical engineers, and, you know, I knew about peptides, but it was never in the sort of like therapeutic sense. I don't know about you, but
yeah, it's because at least I think because they're still kind of going through studies on them, but there's a lot of like anecdotal evidence. I know a lot of athletes use it like for a reason, right? I mean, it's another one of those things where you can try for yourself and notice a massive difference. Or, you know, it is ultimately like up to an individual, but a lot of the anecdote points in like this stuff works. And so, but for a lot of people listening, I actually wanted to kind of have you break down what are peptides, and then we'll talk about like what they're not, because I'm sure a lot of people have like skepticism or think it's something else that it isn't. But
right.
Yes. Okay. Yes, that's a great question. What people might think about when I say the word peptide is maybe the collagen peptides that are in their cupboard to supplement. They might also think about like a skincare product that has peptides, or what you learn about in 8th grade biology, how a protein breaks down to peptides, breaks down to amino acids.
Right.
That's about my understanding of it.
Yeah, same.
Off the rip. Yeah.
Yeah.
Yeah. And that's, you know, what a peptide is in the body is essentially it's a signaling molecule. And the peptides that we utilize therapeutically in medicine are actually combinations of amino acids in a chain. You could think about it like a train, and you have different combinations of amino acids that make up a different peptide. And they're usually under 50 amino acids in length. Anything over 50 amino acids we call a protein.
Okay.
Right.
According to biochemical terminology. But there are exceptions to that, like insulin is more than 50 amino acids in length, but we do call it a peptide. And that's one of the first peptides that was discovered is insulin.
Oh, interesting.
Cool. Yeah.
Yeah. Same with HCG. That's the one that a lot of people have heard about. It is a peptide, and we do inject it. And HCG is that molecule that women make when they're pregnant. We use it a lot of times in fat loss protocols, and for men to stimulate the Leydig cells to produce testosterone.
Okay.
Interesting.
HCG.
For that. Yeah. There are other peptides that we call our analogs. So they do a similar action to HCG. But essentially what peptides do in the body, say we administer a peptide. And there's lots of different ways to do that therapeutically. We can inject it, which is the most common route, just because we get 100% bioavailability absorption into the bloodstream, into the body. Some of them do come in capsules. We also have certain topicals or creams. There are certain things that we use for hair loss or hair restoration that come in a foam or a topical that way. So there's a limitless, there's a lot of different ways to administer them. But what they do is, for example, with a lot of our peptides for hair regeneration, they can signal the stem cells in the hair follicle to wake up again. So it can activate those to produce hair follicles again for men who are balding or women who are thinning in their hair. So they signal the body in a way that we want to promote a process that has decreased, or that peptide has been depleted with age, with chronic stress, with environmental considerations. Our body makes all of these peptides. It does. The issue is that they decrease with age. For example, growth hormone is one of the hormones that we produce a lot when we're in our 20s. It will drop as we age. As we get close to 60 years old, it's about half capacity. And that's a repair hormone. And so we have peptides that can stimulate our body's own production of that. And the essence of peptide therapy is signaling the pathways that promote rejuvenation in the body.
Okay.
That's the heart of it, I would say.
So now, do you ever get the question, like, are peptides Sarms? Because I know Sarms are like really popular today, right? Like I feel like everyone and their mother is making a supplement company with the new and latest, greatest Sarm. And I'm wondering, I mean, I know that they're different rather, but for someone who is like, oh, they provide some sort of signaling pathway, that just sounds like a SARM. So for that person, could you explain how they're different?
Yes, SARMs are not peptides. There was a peptide company that I was using that was producing SARMs. Technically, SARMs cannot be produced by a compounding pharmacy at this point. But SARMs are a selective androgen receptor modulator. So androgen is, you think about your androgens like testosterone, we can bind to those receptors. That's what SARMs do. Peptides don't work in the same way. Like when we inject testosterone, this is my best analogy. When we inject synthetic testosterone for men, which a lot of times we start to do after the age of 40 or 50 because it just drops off in production. Once we inject it, the body has this negative feedback cycle that says, hey, we got plenty coming in. Let's downregulate our natural production.
Right.
SARMs can do that. So will exogenous testosterone.
Interesting.
Peptides do not do that. What they do is they increase the body's own natural production. There's no negative feedback. That's why they're awesome, is because they really improve the body's function and production of these signaling molecules. And once you discontinue taking them, we don't get this drop-off effect.
Right. Because so kind of the way that you're describing it is the difference between like a SARM and something like in the example of testosterone is that you're giving your body something and it's saying, oh, we already have plenty of these supplies. So, and we're just going to stop producing the testosterone. But in the peptide case, what you're doing is you're saying, here's the building block, but you still have to do the work, body. Like we gave you the recipe, but you still got to go cook it. So I guess is that a good way to put it?
Yeah.
Okay.
Yeah. We don't want to shut off your body's own production.
Yeah, absolutely. Right.
Same thing happens when we inject human growth hormone, the actual hormone. Your body's own production will drop. It'll drop through the floor. And so a lot of people, when they discontinue taking it, they get a ton of side effects because their body is no longer repairing and recovering like it used to.
Right.
Peptides have the opposite effect. When you discontinue taking them, we've actually shown that you're better off than baseline.
Interesting. Well, that's really cool.
Yeah, it's kind of nuts.
So now I know you have a lot of different clients and a lot of people that you work with. What are some like common people and like problems that you run into that you address with peptides?
Yes. Oh man. So I work with both men and women in peptides. I really started off as a women's health doctor. So I was running a lot of hormone testing and helping women with gut health. And the big common issue that I see with a lot of women is immune issues, autoimmunity, namely.
Thanks.
And there's a suite of peptides that works better than any other treatment that I've seen in my practice that re-regulate the immune system. Those are the same ones that I used on myself. And so autoimmunity is a huge one, and that can be autoimmune thyroid, so Hashimoto's, Graves'. I have some other young people. I have a young man with ankylosing spondylitis, so that's where the spine will fuse. Lots of back pain.
Whoa.
Oh man.
Jeez, that sounds really serious.
To really turn that around. With the back pain, he is now doing like deadlifts and training and doing awesome on some of these peptide therapies. So autoimmunity is a huge one. Because what happens in autoimmunity is the immune system is confused in its signaling. So we can re-instruct it to signal appropriately. We don't want self-attacking self. We want self-attacking pathogen or bacteria or virus.
Right.
And autoimmunity is a rampant issue in our country, not just in women. It's very, very common in women, but in men too. And we can use peptides to redirect the signaling of the immune system. There's a peptide that's called thymosin alpha-1. And the story on the thymosin peptides, there's one called thymosin beta-4, which you guys are familiar with, and thymosin alpha. So those are two thymus peptides. Our thymus gland is like about right here behind your sternum. And when you're a young child, your thymus gland is working at full capacity, about age 5, 6. You respond to everything really well. You get sick, you get really sick, and then you get better quickly. When you get a cut, you heal really fast. Your energy is amazing. You're just your thymus is just 100% capacity. What happens with age is that your thymus will shrink down to about 1/6 of the size that it was when you were a child. And so you don't make those thymus peptides anymore in the same way that you did. So this is a huge player in autoimmune. What we think is happening in autoimmune conditions, we know there's some studies specifically on some of these autoimmune conditions, one in ankylosing spondylitis patients, where they have really low thymosin alpha levels. So we can inject them with this peptide that repletes their body's signaling to make it. And that decreases pain. Your immune system takes a lot of energy, can improve energy. We see just a reversal in the signaling process that happens in autoimmunity.
Wow, that's amazing.
Same with thymosin beta. It's a recovery peptide. It's a immune peptide, but it's really specific for muscle tissue and repairing muscle tissue. So I love using that one. A lot of times I'll use thymosin beta in a post-surgery protocol with BPC 157. So I have some like mountain bikers and they go out and break a wrist every couple months. And people are getting injured all the time. Very active. And so if they're going into surgery or they're trying to heal faster, we'll put them on a peptide combo or what we call a peptide stack. Help them heal and repair faster.
So what are like the more common ones, or I guess, I don't want to say well-known, but what do you think the most ubiquitous peptide that you either prescribe or you see?
It's a good question. I'd say the one that most people would have heard about, if they know about peptides, is one called BPC 157.
Yeah,
and
that's funny because I had heard of that one before.
Yeah, it was on the Mind Pump, right?
Yeah.
Yeah, so that one's probably the most common. It stands for Body Protection Compound, and our body normally makes that in our GI system, in our stomach acid, and it protects the mucosal lining in the gut. So for anybody with acid reflux, leaky gut, intestinal permeability, IBS, IBD, Crohn's, colitis, any sort of GI issue, that's a golden one. Also, anybody with joint pain, you know, they're not healing well. BPC is very specific for connective tissue. So for post-surgery healing, thymosin beta, BPC, beautiful combo.
Great stack.
Yeah.
Great stack. Yeah.
So it sounds like a lot of these are gut related. When you do, or, you know, prescribe like peptide therapy, do you talk about like diet at all if somebody's having specific gut issues, right? That has direct implications on their hormones, and you're trying to do some correction. Do you like give advice there, or do it in tandem with some kind of diet work?
Yes. Yeah. So I have two different types of consults. I have peptide specific consults where somebody is really handling a lot of the other lab testing, maybe with another functional doctor in their area. But I also have a full on 1 hour consult where we go head to toe through everything. We run labs, we assess that. And absolutely, in a lot of those cases, we're doing nutrition and dietary related things with the peptide interventions.
Right. That's smart.
There's a lot of people who come to me who have all of those other things optimized. They have their doc for hormones. They have all that's kind of settled. They have a nutritionist, or they're really high level. They've been training and doing this for a while.
Right.
So the missing piece for them, the next level element, is the peptides. And so that's all we talk about because they have all that kind of managed and in a good place. But yes, these are a very adjunctive thing. They will not make up for a poor diet. They will not make up for lack of sleep.
Right.
They can optimize function. They can deepen sleep on a lot of levels, but they don't make up for, awful lifestyle factors that are common.
Those are like the big rocks. You kind of got to take care of those first.
Absolutely. Yeah. This is more of a next level treatment strategy. Especially a lot of people come to me and they've seen other doctors, they've been put on a lot of medications and they feel worse. They're like, I need another, they know that there's a way to get better. They just don't know how to get there.
Right. Yeah, I think that's honestly a lot of people too, just with nutrition in general. Like sometimes they know that like what they're eating isn't good, and they know that they don't even know how to make the right choices. And they're like, well, I know that what I'm doing is not good, but there's so much out there for information. I don't even know where to start.
Yeah.
I imagine that probably if someone hears about peptides, there's like a bajillion peptides. So like, it's, how do you know where to go? And I guess Dr. Amber is the way to go, right?
Yeah. And that's really what the consult is designed to do, is discuss the individual's personal health challenges, diagnoses, medication, supplements they're already taking. How does this fit in? What are the expectations around treatment? What's going to be the best fit for them in terms of what we're looking for in outcomes?
Very cool.
And they could really be used therapeutically. Like I have mycotoxin patients who their house is full of mold and they're chronically ill because of that. And we use thymosin alpha. We use melanotan-2, which is the tanning peptide.
Oh yeah, wait. Real quick on that? So like, does that affect like your vitamin D at all too? Just I don't know if like, because if you're getting tanner, right? Like you're also, if you're out in the sun, obviously you'd get less vitamin D. But I didn't know if it also did something with vitamin D, like help its absorption or something like that.
So, not directly.
Okay.
How it works is you could not see the sun for 3 months and you could inject yourself only with this and you will get the tan that you would get if you were in the sun. So it will not, even if you're not in the sun, it'll make you tan, but that doesn't mean that it's changing your vitamin D absorption. You could be getting zero sunlight and it'll still make you tan.
Interesting.
But yeah,
That's so
it works
crazy.
on the system in the brain called the melanocortin system, which is fascinating. Oh my gosh, it like relates to sleep and libido and skin tanning and appetite. And if you tap into this system, you can really do some cool things, including tan yourself. They have peptides that are specific for boosting libido. But there's all sorts of awesome effects of that system in the brain.
Interesting. Just because I am very curious, like, what could you go through some of those effects of this melanotan too?
Yeah. So we call it the tropical vacation peptide
Oh man.
for certain reasons. And namely, if you go to a tropical island, what would you typically experience? You would be in the sun, so you get tan, get a lot of sunshine. You would probably feel less stress.
Mm-hmm.
You'd have higher libido. You're on vacation.
Yeah.
You would have less appetite. Say you're in Fiji. You're just not quite as hungry. You're active all day long. You're in the sun. And it can have some immune modulating benefits. So that means for somebody who is reacting to a lot of foods, their immune system is hypersensitive. They have autoimmunity. They have mycotoxin exposure or Lyme or EBV, mono. It can help balance that immune response. So it has a lot of the effects that you would get if you wanted to go to Fiji, but you couldn't go and you want to just inject yourself.
Little Fiji injection.
Yeah. It really does. And I've experienced that one, and I've had multiple patients experience that one. I use it a lot in people who compete bodybuilding because they need to be tan and they don't want to be in a tanning bed, and the self tanners aren't so good. And it really will give you this full body tan with no tan lines.
So
that is kind of crazy.
That's so crazy. Now, like, just because I'm still curious about this, when you do use it, is your tan like the same as to if you were to go in the sun? Because everyone's got a different color of a tan, right? Like, I have a more like olive skin tone, and someone else might not even tan that well. So I'm thinking about like the Irish person that tries to use this. Like, what do they just get slightly less pale? Like, what's the will they see the first tan of their life?
Yes. Yeah. It depends on what your body would naturally do. So,
okay.
But yeah, somebody who's very European white skin will develop a tan.
Interesting.
It may take a little bit more dosing. The one thing that is to be aware of with this one is you really want to dose it low and slow, because if you dose it too fast, you can get hyperpigmentation of a lot of the moles and the freckles that you already have, or you might notice new ones. You don't want to take massive amounts real fast.
Interesting. That was going to be my follow-up question, because I was going to be like, do you get like the people that do get freckles in the sun, do they experience freckles with this? And it kind of sounds like you do, almost like if you were to lay out too long, too early in the summer, you get burned. Kind of sounds like you sort of burn, but not so much with using this.
You never get the sensation of being burned.
Right.
However, you can develop those freckles and moles.
Interesting.
If you use too much too soon. And so that's one of the things to be aware of. I don't give this to anybody with a history of melanoma or skin.
Actually.
Yeah. But the one caveat to that, because the follow-up question is, does it cause melanoma or anything like that? Because it causes the darkening of those moles and freckles. And the opposite has been shown to be true. It protects you from UV damage. Okay. When I was using it, I live in LA and the sun is out and it's very strong, all day long, almost all year round in LA. And so I could be outside all day long and not burn because you develop a base tan. But even if I would spend very little time outside and then I'd spend a whole 8 or 10 hour day outside, I would not burn with the melanotan.
Interesting.
Because the more melanin you have in your skin, you can think about somebody who's African American, they need more sun and they don't burn as easily as somebody who's, white or Caucasian skin tone.
Right. That makes sense.
That protection. And the less sunburns you have, the less likely you are to get melanoma.
Mm-hmm. Right.
There are some research studies about how melanotan 1 and 2 can provide that UV protection, can actually protect you from sun damage.
Right. I mean, that makes sense if it's increasing the melanin in your skin. So I get that. Now,
Yeah.
moving on to, I want to talk about muscle building because we do talk about that a lot about that on this show.
Oh yeah.
Right.
So let's go through some of these like peptides that would help someone who's trying to maximize muscle growth.
Yeah. This is really fun. So I'll tell you about my favorite peptide combo. It's called CJC 1295 and ipamorelin.
Mm.
And you can use those separately, but oftentimes we will use them in conjunction. They're 5 times more effective when you combine them.
Oh man.
So like a nice synergistic effect then.
Yes, very synergistic. And the analogy that I like to use with this one is that you can think about a warehouse that produces a product, say like radios, and that's your growth hormone. So the CJC will increase the production of that growth hormone, and the ipamorelin will ship it out. It's like the truck, the Amazon delivery truck that will deliver it and get it out of the pituitary gland.
Oh, interesting.
One boosts production and one boosts utilization and distribution.
Interesting. So that's why they work so good together. Because if you have just one or the other, you're either producing a lot of radios and no shipment, or you're getting a lot of shipment and you still have the same amount of radios.
Correct.
Okay.
Yeah. Yep. So that's the easiest analogy to how they work.
Okay.
Just make it super simple. But they signal the pituitary, which is that organ, that gland in the brain, that really is the master signaling gland. So our thyroid signaling, all of our hormone signaling comes from that pituitary gland, but so does our growth hormone signaling.
Mm.
That will boost your body's own natural production. This is different than injecting a synthetic growth hormone, very different.
Right.
Boost our body's own production. We shuttle it out to the body. The beautiful thing is we have growth hormone receptors everywhere in the body.
Right.
In the brain, in the gut, in the muscle tissue, in the bone tissue, everywhere. So what I noticed when I introduce these to some of my patients who say, I'm not sleeping deeply, I'm not recovering from workouts, I feel like I don't repair, I'm aging faster, my skin doesn't look as good, I can't build muscle as well.
Mm.
When we add in these peptides and we dose them at night fasted, we see a lot of these symptoms that they have improve. We see deeper sleep levels. We get that deep delta wave sleep, which is probably the most efficient type of sleep for hormone regulation, especially for men and testosterone.
Right.
We know that decreased deep sleep will decrease testosterone levels. So we see that. But it also, because it binds to bone and to muscle, we can strengthen the bone, and the muscle can only grow as strong as the bone is. It's like an axis, right? They both need to be strong.
Right.
It's interesting because I've also worked with some young men who are athletes, and they tend to fracture easier, or they have certain injuries that happen. And you think about how much they're using their muscle tissue as they're working and training. And at such a young age, maybe 25, 30, having these fractures is really concerning at a young age. So that would strengthen that bone. And this peptide is phenomenal for doing that.
Mm.
But also you think about aging men and women. We go sarcopenic and we go osteopenic. So we lose our bone and our muscle mass, which is like our life force as we age.
Right, right. The fountain of youth.
Preserve that, which is so valuable.
Yeah.
Right.
I mean, it's true. I mean, you're only really going to be able to like lift or grow as much as your body is going to be able to support physically, like with your bones. So,
Right.
I'm sure you'd get more, the higher your bone density, the more potential you have for building muscle. Anyways, it's like your body is going to let you build more just because it's, it's safer.
Yeah, that's the whole like the thickness of your wrist kind of determines like how big you can actually get genetically.
Yeah. Wrists and ankles.
Wrists and ankles, yeah.
But I wanted to ask, so has this become more like popular as of late and since you started? And then like do you think, or when, or do you think if ever it'll become kind of super mainstream, commonplace to see like peptide therapy?
Yeah, great question. So the secret is not out. There's thousands, hundreds of thousands of people who don't know about peptide therapy. Really what it is our body makes these, but people don't understand that the production drops as we age, and they don't understand what's happening in the cell to age them and decrease the health of their tissues over time. And so what peptides do is they address that. We correct signaling, we promote repair in pathways that we want to promote, and that we know that they really do prevent faster aging, loss of muscle mass. We can reverse those things, which is powerful. And it is a new field. It's relatively new. A4M, the encouraging thing is there's a lot of large organizations that are run by MDs and conventional medicine that are in the anti-aging space, though, that have training for their doctors on peptide therapy.
Interesting.
The Medicine Management Group, AMMG, they have training on it. A4M, the Academy of Anti-Aging Medicine, massive organization that's all over the world. They have training on it for doctors. There's a lot more clinics, I think, more on the coasts, like the West Coast especially, that offer some of these peptide therapies, and they do see that they work faster than many of the other therapies that they have. And so that's what got me excited, and I think why people are catching on to this. Will they ever be... so something interesting happened this year where the FDA actually changed the legislation of some of these peptides to make them unproducible by compounding pharmacies, because they saw the profit margin and they said, hey, we want to ban the production of these and only allow them to be produced as drugs.
Oh,
okay.
Huh. Okay.
So that happened in March of this year, of 2020. And there are still a lot of peptides that are available. Many of them were not affected, but one of the ones that was actually HCG. It is no longer able to be produced by compounding pharmacies.
Huh. Interesting. And you think the motivation behind that is purely financial and nothing to do with anything else? Yeah.
Oh, yeah. So, yes, there are a lot of, there's a huge financial incentive for running this market, and not... What's happening right now is that there is a black market for peptides as well. So you can buy them online. A lot of times they ship them in from China. They don't test them. They've been sitting on a shelf.
Yeah.
I've had I've heard some crazy stories about people tasting metal in their mouths, people injecting it into their joints and going septic.
Oh my God.
Oh, no. No.
So don't buy them online. There's a black market. The worry is if some of these peptides, the FDA says, hey, we can't produce them in a compounding pharmacy where they test it and it's all legitimate and it's dispensed through your doctors. We want to turn it into a drug and then only bill through insurance and limit the availability and, make it a really expensive drug. The black market will grow because the drug development process could take up to 10 years and people will be going and finding other places to find them. Yeah. And I'll be honest, like the first time that I used peptides, I didn't know where to find them and I didn't know anything about them. And I went online and got melanotan too. And I was like, what is this? How do I, I just experimented. So, but there's also like, especially, you guys, you pay attention to what you put in your mouth and in your body, and you just don't want to be buying things online, especially if it's an injection and not knowing.
Yeah, for sure.
Yeah,
for sure.
Yeah.
I mean, sure, people are hesitant about doing injections, period, let alone I would hope you go on the internet and just buy something from, some random, I wouldn't buy it off Amazon, you know what I mean? Or like Facebook Marketplace.
Yeah. That's the thing is you definitely if you're gonna it just makes sense. I guess it's the only thing is that I could see someone not even knowing that there's doctors like yourself out there that even offer specialized, customized peptide therapy solutions. So I could see why someone would just go on Google and be like, "Oh, I heard about BPC 157. Where can I buy that?"
Yeah.
And then they find like, so I don't even want to give the brand a shout out, but there's a brand right now selling BPC as a nasal.
Yeah.
Now is the nasal? I don't even know. It's not an injection, right? It's a nasal inhalant. Is that
I guess.
Nasal,
yeah.
Yep.
Yeah. Is that effective for BPC or I think the other one I saw for was thymosin beta 4 too.
Yeah. So there are certain peptides that we'll compound it into a nasal spray. There's actually a blend of 3 things that I love using for brain function. One's called RG3, which is the red Korean ginseng. It's amazing for energy, stamina, brain function, focus, clarity. Then you have methylcobalamin B12, which we know boosts brain function. And you have NAD or NR, which is the precursor to NAD. So that is you can look up that combo. It's called synapsin. You have to get a prescription through a doctor to get that, but it is really powerful for boosting brain function, and also for a lot of my chronic illness patients who have mold exposure from their house and they've been inhaling it, and it's neurotoxic, right? It can actually damage the brain. And so the intranasals are very specific for the brain. If memory, forgetfulness, chronic illness cases, EBV, where we're having a lot of neurological symptoms, that's when we do a lot of the intranasals. That's when I find it really helpful.
Okay.
Cool. So do you guys, because it needs to get into your bloodstream, and this is, I haven't seen anything like this, but do they make like eye drops? Because I know that, your eyes is like, that's like a quick way to get something into your bloodstream is like through your eyeballs.
Yeah. So there actually exists a BPC drop for eyes, compounded. And I used BPC. So I had LASIK eye surgery about a month ago, and
no way.
They essentially destroy part of your cornea and let it regrow over a period of a couple of months.
Yeah.
BPC is amazing for corneal regrowth. It's like one of the best indicated things you could do.
Interesting.
For corneal growth. So the drops would be a more specific way. You could also inject it. You could take the capsules, but the drops would be very specific to the eye.
So I've heard actually of BPC being used, or I guess you can use it like site specific, like intramuscular. Is that common? And it sounds like it would be more painful.
Yeah, than just like the subcutaneous injection.
Yeah, I haven't used it intramuscular, but theoretically it's possible to repair some of that. It's very specific for connective tissue.
Mm-hmm.
So I think about it, like I've seen it done as joint injections, but you never want to do that at home because you need a sterile field. You need to have a doctor that's like everything, a clean room, essentially, set up, gloves and all of that to do a joint injection. But yeah, you could technically, if you have no abdominal fat and you have a lot of abdominal muscles, you may end up inadvertently injecting it into your muscle, and there's no harm in that.
Okay, yeah. I guess the follow-up question was going to be like, what happens if you do accidentally do that?
You have blood vessels that, if anything, your muscles are more well vascularized. The goal in injecting it into the fat is for the blood vessels to uptake it and for it to go systemic.
Right.
So that it signals systemically, which all peptides do. Melanotan's the perfect example of that because you inject it to the stomach, but it's not just your stomach that gets tan, your whole body does.
Yeah, that's so interesting. I've just, my thighs have never been tan in my life. It would be so weird to see tan thighs on myself. You know what I mean?
That's true.
The farmer's tan.
It's blinding white.
Yeah, it's like the shortest tan I've ever gotten is like I wore a pair of like shorter bathing suit shorts, But after that, it's like pure whiteness,
Yeah, it can work wonders there.
Cool. Yeah, I mean, I don't know how much more I'm trying to think like, oh, you know what? We got to talk about like, because I know someone's going to be like, this all sounds like great, but there's got to be a negative, right? Like, so to that person who's skeptical, we have to address that because,
Absolutely.
it's very nice to talk about all the wonderful things that they can do, but I'm sure someone who's listening for the first time is definitely curious.
Oh, absolutely. And I address that question in almost every consult. What are the side effects? Are there drug interactions? What do I need to know about these peptides? All in all, like if I were to speak we have 7,000 peptides and 70 that we use therapeutically. So there's still a huge world of things that we don't even use yet that are being explored and have been used historically. But we have 70 that we use. Out of those 70, the side effect profile is extremely low. There are specific peptides that there's a caveat, like melanotan-2, it can darken the freckles, and that's one thing to be aware of. There's certain, in general, like we're more cautious with anything that we use in medicine. As somebody who has an active case of cancer, somebody who's pregnant, breastfeeding, we don't use these. But I would say 98, 99% of the time, people respond phenomenally. They feel better. The reason that is because these work with the body. Your body produces these peptides, just the amount has been decreased, like APC. And so when we restore those levels, we get improved gut health, we get improved protection of the gut lining, we get improved mood, all the neurotransmitters. I mean, we improve the function of the body.
Right.
And when we look at, often in medicine, we're worried about drug-herb or drug-drug interactions, and I'm trained to assess that when I work with a patient. Peptides don't even have that capacity in the sense that the level at which we're worried about drugs interacting with each other is in the liver. And the metabolism happening in the liver. Peptides don't tax the liver. They don't tax the kidneys. They don't metabolize in a involved way in the liver like drugs do. Drugs often will damage a lot of drugs that are what we call hepatotoxic. They damage the cells in the liver. Peptides could actually potentially improve the damage that's done by drugs.
Interesting.
Cells. Wow. There's some mitochondrial peptides that we use that actually can support the liver from the damage that has been done by drugs. So we don't see the same side effect profile. There's very low adverse reactions to these. The one case that I've seen is a woman who had like 3 other autoimmune conditions. And we started her on this peptide protocol, and she actually developed antibodies to it. So she just was a non-responder.
Okay.
Interesting.
That's one out of hundreds of people. It's very rare to see adverse events. They're very well tolerated. The thymosin alpha peptide, which is the one that I used for it's antiviral, antibacterial, antifungal. So I used it for COVID prevention, and I actively give it to patients that are helped to support their immune system and use it in autoimmunity. That one we give massive amounts IV, and the more you give, somebody responds better. It's almost impossible to overdose.
Interesting.
In these as well, especially thymosin alpha. What happens is if you take too much, all the receptor sites are already bound and there's nowhere to go. So you just waste your money essentially if you take too much.
Yeah.
So is there ever any sort of like down regulation? So like, let's say you took something like CJC or BPC 157, you took them same dose for a while. Does your body ever stop responding at the same way it used to? Like, will it ever, almost like when you eat a ton of sugar and then you go and you grab that last Oreo and it just tastes like nothing? Like your tongue has down regulated the goodness of that Oreo? Is it ever like that?
It's a good analogy. With most of the peptides, no. The one exception to that, and we've strategically designed a dosing protocol to avoid that from ever happening, and that's the CJC ipamorelin. That's why we do the 5 days on, 2 days off dosing. Because if you took it 7 days a week, you'd actually get a decreased effect. That's what we found in studies.
Oh,
Interesting. Interesting.
Yeah. You're keeping your receptors awake, alive, receptive, open, so that we don't overwhelm them. That's not really true with a lot of other peptides. Like you can dose BPC, you can dose thymosin alpha, you can do daily dosing. But a lot of times we'll do the 5 days on, 2 days off, not only for the simplicity of your schedule and your work week and your weekend, if you're traveling, but because it keeps those receptors fresh.
Okay. Very cool. Yeah.
Yeah.
I mean,
all right. Well, yeah, no, I mean, that was everything I had questions on. I thought that was pretty good.
Yeah, that was a lot of fun.
For anybody who doesn't know
Yeah.
about peptides, they definitely will after this. So
yeah, this is great. And then, so before we like head off, do you want to maybe tell people where they can find you, either Instagram, website, all that jazz?
Yeah, absolutely. So you can find me on Instagram at Dr. spelled out DOCTOR, Amber, ND, like North Dakota. And then you can find me on my website at drambernd.com. And that's the easiest way to book a peptide consult. You can learn more about peptides. The other place that a lot of the listeners could look if they're like, what are all these peptides? I need to see this in writing.
Right.
Or learn about it, read about it. So I do have a free PDF. It's at peptideplaybook.com, and they can go there, enter their email, download that. It talks in depth about a lot of these peptides and what they do and how we use them. So they can always learn more there.
Awesome.
Cool.
Awesome. Well, thanks so much for joining us, Amber.
Thanks for coming on the show.
Yeah.
Thanks for having me on. This was really fun.
Yeah, absolutely. And then, I guess that's it.
Yeah.
Sweet.
Thank you for listening to Bone Apple Tea. We release new episodes every Monday and Friday, where Monday's episodes take a deep dive into specific topics, and Friday's episodes we discuss current events and have fun. Make sure you subscribe so you don't have to do anything to get the latest episodes.